1.
Hi, Dr. Keaten from Mainely Veterinary Dentistry, and we wanted to speak about root canals a little bit. We've been doing root canals here a few years now, and it's a great option for your pet if they've broken a major tooth. So oftentimes if we're going to do a root canal, it's on a canine tooth because they're grabbing teeth in the front. It's very common for them to break one of those 4 major canine teeth. And the upper carnassial, that big 4th premolar, they use a lot to chew, especially if you give your dogs bones or antlers, which we don't recommend. They often break that big chewing tooth. So it can be an option to save those teeth in some circumstances with a root canal. And what a root canal is we actually make a hole into the pulp cavity. So there's in the center of the tooth in each root, there's a pulp cavity that houses the blood supply and the nerve. That's soft tissue that gets infected once it's exposed. And so we have to remove that soft tissue part from the center of the tooth. So we actually file out the center of the tooth. And for our carnassial tooth, we've got 3 roots that we have to get out. And then a canine tooth has 1 big root. So we're using hand files to remove the center of the tooth. And then we fill it with a filling material and restore the crown. That allows the tooth to stay in place, even though it is no longer vital because it does not have the blood supply, but there's no soft tissue left in there to be infected. Then we have you come back 6 to 12 months later just to make sure the root canal was successful. So some of the things you might want to think about when considering a root canal is that it is more expensive, so we'll go over the cost with you to make a decision. It takes longer to do a root canal, so an extra hour or 2 of anesthesia depending on how many teeth and which tooth. As your pet ages, doing a root canal becomes harder and harder because those pulp cavities become more narrow. So there is a certain point when we may not be able to perform a root canal here. As well, if there's any significant signs of infection or tooth resorption, then a tooth may not be a candidate. The benefits of doing a root canal is, one, of course, the animal gets to keep the tooth, right? So that's a great benefit. That also reduces the amount of tartar that might build up if it's a chewing tooth on the tooth below, because we can continue to chew on that side and then we don't get as much tartar buildup. It's way easier for an animal to recover generally from a root canal as well because it's less invasive. We're only removing the center of the tooth versus making an incision in the gingiva, removing some bone, and elevating out the whole tooth. So recovery is much easier for a root canal. They don't have to wear a cone. They can go back to being basically their normal selves the next day. So those are kind of the pros and cons of root canal versus extraction to help you better make an educated decision. And we're here to help you along the way with your questions. If you want more information, you can go to our website at mainlyvetdentistry.com.